Prostate cancer is one of the most common cancers affecting men worldwide, and its prevention is a subject of intensive research and public interest. Over the years, scientists have explored various factors that could influence a man's risk of developing prostate cancer. Among these, the frequency of ejaculation has emerged as a topic of particular curiosity and, more recently, growing scientific attention. Many wonder, can ejaculating every day actually prevent prostate cancer, or at least reduce the risk? To answer this, we need to delve into the latest research, understand the mechanisms being proposed, and place these findings within the broader context of prostate health. First, it's important to recognize the scale and impact of prostate cancer. Each year, hundreds of thousands of men are diagnosed with this disease, and while medical advances have improved survival rates, prevention remains a crucial goal. The idea that something as natural and routine as ejaculation could play a role in prevention is both intriguing and, for many, hopeful. Where does this idea originate? The roots of this hypothesis trace back to epidemiological studies conducted in the late 20th and early 21st centuries. These studies sought to identify lifestyle factors that might influence prostate cancer risk. Among the findings, patterns began to emerge suggesting that men who reported more frequent ejaculation tended to have a lower risk of prostate cancer. However, it's only in recent years that more comprehensive and rigorous analyses have started to clarify this relationship. A pivotal development in the ongoing investigation came with a comprehensive analysis published in 2004. This review synthesized data from multiple studies, providing a more robust examination of the association between ejaculation frequency and prostate cancer risk. The findings were compelling. Men who ejaculated 21 or more times per month experienced a reduction in prostate cancer risk of approximately 19% to 22% compared to those who ejaculated less frequently. This means that daily ejaculation, or something close to it, was associated with a significantly lower incidence of prostate cancer in the men studied. To put these numbers into perspective, a 19% to 22% risk reduction is notable, particularly in the context of a disease as common as prostate cancer. If these results hold true across larger and more diverse populations, they could suggest a meaningful, accessible way for men to lower their risk of developing this disease. But, as with all scientific findings, it's important to dig deeper. Why might frequent ejaculation have this protective effect? Researchers have proposed several mechanisms. One leading theory is that regular ejaculation may help flush out carcinogens, potential cancer-causing agents, from the prostate gland. Over time, harmful substances can accumulate in the prostate. By regularly clearing out fluids, the theory goes, men may reduce the chances that these substances linger long enough to cause cellular damage that could lead to cancer. This flushing hypothesis is supported by observations that the prostate gland produces the fluid expelled during ejaculation, suggesting a direct connection between ejaculation and the health of prostate tissues. Another possible mechanism involves hormonal regulation. Ejaculation affects levels of certain hormones, including testosterone and its derivatives, which play a role in prostate health. Maintaining hormonal balance through regular sexual activity could, in theory, reduce the risk of abnormal cell growth in the prostate. Additionally, regular ejaculation may be linked to other aspects of a healthy lifestyle. Men who are sexually active may also be more likely to engage in other health-promoting behaviors, such as exercising regularly, maintaining a balanced diet, and managing stress, all of which can contribute to overall prostate health and lower cancer risk. However, as promising as these findings are, it is crucial to emphasize that correlation does not necessarily imply causation. In other words, while frequent ejaculation is associated with lower prostate cancer risk, this does not prove that ejaculation itself is the direct cause of the reduced risk. Other factors could be at play. For instance, men who are able to ejaculate frequently may have better overall health, more robust libido, or fewer underlying medical conditions, all of which could independently lower their risk of prostate cancer. Moreover, not all studies have found a clear association between ejaculation frequency and prostate cancer risk. While the most recent analysis points to a significant relationship, some earlier research found no statistically significant connection. This inconsistency highlights the complexity of prostate cancer and the many variables that contribute to its development. Genetics, for example, play a substantial role. Men with a family history of prostate cancer are at higher risk regardless of lifestyle factors. Diet, exercise, exposure to environmental toxins, and even race and ethnicity are all influential. Given these nuances, how should men interpret the current evidence? Should daily ejaculation be adopted as a proactive strategy for prostate cancer prevention? The answer is both straightforward and nuanced. On the one hand, the latest research provides encouraging evidence that frequent ejaculation may play a role in reducing prostate cancer risk. On the other hand, this is only one piece of a much larger puzzle. Maintaining prostate health and reducing cancer risk involves a holistic approach. Regular screenings, especially for men over the age of 50 or those with a family history of prostate cancer, remain the gold standard for early detection and successful treatment. A balanced diet rich in fruits, vegetables, and healthy fats, regular physical activity, maintaining a healthy weight, and avoiding tobacco and excessive alcohol are all proven strategies for lowering cancer risk. Men considering changes to their sexual habits for health reasons should also be aware that more is not always better, and what is most important is overall well-being. Sexual health is influenced by many factors, including psychological, relational, and physical health. If concerns or questions arise, consulting with a healthcare professional is the best way to receive personalized advice tailored to individual circumstances. Let's take a moment to explore some of the details behind the most recent study, as well as the broader implications for men's health. The 2024 review, which stands out for its scope and methodology, analyzed data from several large-scale epidemiological studies. These studies involved tens of thousands of men, some followed for more than 2 decades. The researchers controlled for a host of confounding variables, such as age, race, family history, lifestyle habits, and even frequency of sexual activity earlier in life. After accounting for these factors, the association between higher ejaculation frequency and reduced prostate cancer risk persisted, strengthening the argument that there may be a genuine protective effect. Interestingly, the protective association appeared strongest for men who maintained frequent ejaculation consistently over many years, rather than those who increased their frequency later in life. This suggests that the potential benefits may be cumulative, with regular ejaculation across adulthood providing the greatest protection. The reduction in risk, 19% to 22%, was observed primarily for total prostate cancer and did not appear to differ substantially between more aggressive and less aggressive forms of the disease. This is an important distinction, as some previous studies had found potential differences in how ejaculation frequency affected the risk of slow-growing versus fast-growing prostate cancers. It's also worth noting that the association was observed across a range of ejaculation methods, including sexual intercourse, masturbation, and nocturnal emissions. The key factor seemed to be the frequency of ejaculation itself, rather than the means by which it was achieved. Despite these encouraging findings, the researchers were careful to point out that their results do not establish a definitive cause and effect relationship. While the association is strong and consistent across multiple studies, it is possible that other unmeasured factors could be influencing the results. For instance, men who are more sexually active may have higher levels of certain hormones, or may be more attentive to their health in general. Additionally, some studies included in the review found no significant association between ejaculation frequency and prostate cancer risk. The reasons for these discrepancies are not entirely clear, but may relate to differences in study design, population studied, or how ejaculation frequency was measured. Given these uncertainties, the scientific community agrees that more research is needed to fully understand the relationship between ejaculation and prostate cancer. Large prospective studies that can control for a wider range of variables and follow men over longer periods of time will be crucial in clarifying the picture. In the meantime, what practical steps can men take to protect their prostate health, based on the best available evidence? First, regular ejaculation appears to be safe and may confer benefits beyond prostate health. Studies have linked frequent ejaculation to improved mood, better sleep, lower stress, and even enhanced immune function. For men who are able and interested, maintaining an active sex life can be a positive part of a healthy lifestyle. Second, regular medical checkups remain essential. Prostate cancer often develops slowly and may not cause symptoms in its early stages. Screening tests, such as the prostate-specific antigen, PSA blood test, and digital rectal exam, can detect problems early when they are most treatable. Men should discuss their individual risk factors with their healthcare provider to determine the most appropriate screening schedule. Third, attention to overall health is key. A diet rich in fruits, vegetables, whole grains, and healthy fats has been associated with lower cancer risk. Regular physical activity, at least 150 minutes of moderate exercise per week, helps maintain a healthy weight and supports immune function. Avoiding tobacco and limiting alcohol intake are also important for cancer prevention. Fourth, men should be aware of the symptoms of prostate problems, which can include difficulty urinating, frequent urination, especially at night, pain or burning during urination, and blood in the urine or semen. While these symptoms are often caused by benign conditions such as benign prostatic hyperplasia, BPH, they should always be evaluated by a healthcare professional. Finally, it's important to remember that sexual health is an integral part of overall well-being. Open communication with partners, attention to psychological health, and addressing issues such as erectile dysfunction or low libido with medical support can all contribute to a fulfilling and healthy life. In summary, the latest research suggests that frequent ejaculation, potentially as often as every day, may be associated with a reduced risk of prostate cancer. Men who ejaculate 21 or more times per month appear to have a 19% to 22% lower risk of developing the disease compared to those with less frequent ejaculation. The mechanisms behind this association are not fully understood, but may involve the regular removal of potential carcinogens from the prostate gland, hormonal regulation, and other health-promoting behaviors linked to sexual activity. However, these findings should be interpreted with caution. The association observed in recent studies does not prove causation, and other factors, such as genetics, diet, and overall health, play substantial roles in prostate cancer risk. Some studies have found no significant relationship, highlighting the need for further research. Men interested in reducing their risk of prostate cancer should consider frequent ejaculation as one part of a comprehensive approach to prostate health. Regular screenings, a balanced diet, physical activity, and avoidance of tobacco and excessive alcohol are all crucial. Consulting with a healthcare professional is the best way to receive personalized advice and ensure that preventive measures are appropriate for individual circumstances. As we look to the future, ongoing research will continue to shed light on the complex relationship between ejaculation, prostate health, and cancer prevention. For now, men can take comfort in knowing that maintaining an active and healthy sex life is not only enjoyable, but may also contribute to long-term well-being. The conversation about prostate cancer prevention is evolving, and the role of lifestyle factors, including ejaculation frequency, is increasingly recognized. By staying informed, engaging in healthy behaviors, and working closely with healthcare providers, men can take proactive steps to protect their health and reduce their risk of prostate cancer. Beyond the numbers and scientific details, it's important to acknowledge the broader context in which these findings exist. Sexual health remains a sensitive and deeply personal topic for many men, influenced by cultural norms, personal beliefs, and individual circumstances. For some, discussions about ejaculation and its potential health benefits may be straightforward. For others, they may be more complex. Healthcare professionals are increasingly aware of the need to approach these conversations with sensitivity, respect, and a focus on overall well-being. Men should feel comfortable discussing any concerns or questions they may have about sexual health, prostate cancer risk, or preventive strategies with their healthcare team. Open dialogue can help ensure that individuals receive the information and support they need to make informed decisions about their health. Furthermore, it's important to recognize that not all men will be able or interested in maintaining high frequencies of ejaculation for a variety of reasons. Age, health conditions, medications, relationship status, and personal preferences all play a role. The goal of prostate cancer prevention is not to prescribe a one-size-fits-all approach, but to provide accurate, up-to-date information that empowers individuals to make choices that are right for them. In this context, the emerging evidence around ejaculation frequency offers a potential tool, one that is accessible, non-invasive, and for many, enjoyable. But it is just one tool among many. A comprehensive approach to prostate health will always consider the whole person, taking into account individual risk factors, preferences, and life circumstances. As research continues, the hope is that our understanding of prostate cancer prevention will become ever more precise, allowing for targeted recommendations that maximize benefits and minimize risks. In the meantime, men can take proactive steps to support their prostate health by staying informed, engaging in health-promoting behaviors, and seeking regular medical care. The journey toward understanding the relationship between ejaculation and prostate cancer is ongoing. Each new study adds to our knowledge, bringing us closer to the goal of effective, personalized prevention. For now, the message is clear. Frequent ejaculation may offer protective benefits, but it is most effective when combined with other proven strategies for health and well-being. Ultimately, the decision about how often to ejaculate is a personal one, informed by individual preferences, health status, and life circumstances. The latest science suggests that regular ejaculation may be a positive choice for those seeking to lower their prostate cancer risk, but it should always be considered within the context of a balanced, healthy lifestyle. For men everywhere, the message is one of empowerment. By staying informed, making healthy choices, and working with healthcare professionals, it is possible to take meaningful steps toward reducing the risk of prostate cancer and promoting long-term health. The path to prevention is multifaceted, and each individual's journey will be unique. With the right information and support, men can make choices that support their health, happiness, and well-being for years to come.